Hello everyone, this is Carrie Anderson. Hope you all doing well. In today's video, I'll talk about thyroid-friendly diet. What would be the friendly diet for thyroid patient? So if you like the video related to total health, I would like to request you all please to subscribe the channel, hit the bell icon or give thumbs up so that I will come up with more and more videos with lots and lots of information. So here we begin. Let's go. Since it produces hormones that affect your entire body, your thyroid is sensitive to what you eat. The more dietary stress you put on yourself, the more likely you are to experience inflammation that can worsen your autoimmune reaction and interfere with your thyroid function. Here are some approaches you can try that are thyroid friendly and may reduce inflammation. Now I'll talk about the gluten-free diet. Celiac disease is an autoimmune condition that causes an immune reaction in your digestive system to gluten, a protein in wheat, barley, and rye, leading to damage in your small intestine. Having this disease can cause poor absorption of nutrients that are vital to thyroid health, like iodine and selenium, and lessen your body's ability to absorb your thyroid hormone replacement medication. Levothyroxine in celiac disease is 3 times more common in people with Hashimoto's thyroiditis and Graves' disease than in the general population. For those with celiac disease, going on a gluten-free diet may help reduce inflammation and lose weight if you haven't been diagnosed with celiac disease but you think you might have it based on your symptoms and or a family history. Be sure to get checked out by your doctor. Even if you simply have a gluten sensitivity, you may benefit from a diet that's low in gluten. Now I'll talk about the low glycemic diet. A low glycemic diet is low in sugar and simple carbohydrates that are quickly absorbed, such as bread, rice, pasta, cereals, potatoes, and corn. The benefit of this diet is that it helps you balance blood sugar spikes, which cause dietary stress. Consistently high blood sugar can be inflammatory as well, so lowering and balancing your blood sugar reduces overall stress on your hormones, including your thyroid hormones. Now I'll talk about the low carbohydrate diet. Similar to a low glycemic diet, a low carb diet helps keep your blood sugar balanced, but it focuses more on the number of carbohydrate you eat rather than the quality. As the low glycemic diet does, examples include the Atkins diet and the ketogenic diet. Now I'll talk about the autoimmune protocol diet. The autoimmune protocol diet focuses on reducing inflammation and healing your immune system. It's appropriate for any type of autoimmune disease and involve eliminating specific food for 6 to 8 weeks, then reintroducing them slowly. Now I'll talk about the elimination diet. Food intolerances and allergens, dairy, soya, and nut, for example, can cause inflammation and make it harder for you to lose weight. It might be worth it to try an elimination diet and or get allergy testing to determine if you have any food sensitivities or allergies. Now be aware of goitrogenic food. Goitrogenic food can slow down your thyroid and promote its enlargement, known as a goiter. Though you don't need to avoid these food entirely, you should avoid regularly eating large quantities of them in a raw form, particularly if you have hypothyroidism. Be especially careful about raw smoothies that may include large quantities of raw goitrogens like kale and spinach. Cooking and steaming these food help reduce the level of goitrogenic properties, but even then, if your thyroid treatment isn't optimized and you are not feeling as well as you could, it doesn't hurt to avoid eating these foods raw and to reduce your intake of the good version too. Some examples of the most goitrogen rich foods include broccoli, Brussels sprout, cauliflower, kale, strawberries, peaches, and peanuts. Now I'll talk about increase your fiber intake. Many people with thyroid disease struggle with constipation and extra weight. One of the key tactics that can help is increasing your fiber intake. Fiber is important for digestion, heart health, healthy bowel movement, and to enhance your feeling of fullness. USDA guidelines recommend that adults consume 22 to 33 grams of fiber per day, depending on your age and gender. It's best if fiber comes from the high fiber food like beans, whole grains, and apple with skin. But if needed, aim for a combination of food and natural fiber supplements such as psyllium to reach higher level of fiber daily. Psyllium capsules are also helpful for a time when you choose to indulge in low fiber, high glycemic food like birthday cake. Taking a dose as directed before eating can essentially help transform what you are eating into a high fiber, low glycemic food that's less likely to spike your blood sugar. Doing this in lieu of regularly following a fiber rich diet full of healthful food, however, is not advised. Now I'll talk about drink enough water. One of the most powerful things you can do to help your health is to make sure that you are drinking enough water. Staying hydrated helps your metabolism function more efficiently, and it can also reduce your appetite, get rid of water retention and bloating, improve your digestion, and combat constipation and fatigue. If you need to lose weight, try drinking water right before you eat. It may help suppress your appetite so that you eat less and hit your weight loss calorie goals. The bulk of your daily fluid intake should be water. Experiment with the type, form, and water temperature that allow you to stay well hydrated. You may find it easier to drink more water if it's a room temperature instead of chilled, carbonated instead of still, filtered rather than tap, or by adding a fresh lemon, lime, or cucumber slice. Now I'll talk about maintain sufficient vitamin and mineral level. Nutritional deficiencies can worsen symptoms of thyroid disease, and though they are not the reason autoimmune thyroid disease come about, they are common in people with Graves' disease and Hashimoto thyroiditis. Ensuring you have sufficient level of certain nutrient is very important to your wellness. Now I'll talk about before you buy supplement. While it does not hurt to increase your intake of food rich in these nutrients before you rush out and buy a bunch of supplement, ask your doctor to test you for any deficiencies. If your levels are good, taking supplement can lead to toxicity, which can worsen your thyroid symptoms and cause other health issues. Now I'll talk about vitamin D. Vitamin D is crucial for your immune system health. It's made in your skin as a result of exposure to the sun ultraviolet rays, and it also found in certain food. Scientific studies have found the vitamin D deficiency may be linked to the development of autoimmune thyroid disease and is more common in people with these conditions. Research has also shown that vitamin D supplementation may help decrease both thyroid peroxidase and thyroglobulin antibodies in people with autoimmune thyroid disease. Now I'll talk about the vitamin B12. Vitamin B12 deficiency is also more common in people with autoimmune thyroid disease as well as the elderly and people who follow a vegan diet due to its important role in red blood cell formation and nerve function. A deficiency in vitamin B12 can cause fatigue, loss of energy, and shortness of breath from anemia, low red blood cell count, as well as numbness and tingling from impaired neurologic function. Current guidelines suggest that those over the age of 14 consume 2.4 mcg per day of vitamin B12. Now I'll talk about the selenium. Selenium is essential for thyroid health, especially since the thyroid contains the most amount of selenium in the body. Low levels of selenium are linked with an increased risk of hypothyroidism, goiter, and both Hashimoto thyroiditis and Graves' disease. Scientists have found some evidence that people with autoimmune thyroid disease who take selenium supplement can significantly decrease TPO and TG antibodies after 12 months, as well as improve mood and sense of well-being. So that's all about the weight loss who have the thyroid. So if you have any certain question, feel free to type in the comment box below so that I will come to know and help you out. And for all of you guys, I prepared a small presentation that will be going to share in the description box below. So before signing off, I would like to request you all, please do like, share, subscribe so that your loved ones will get to know better. So we'll definitely meet in the next video with my other content. So this is Carrie Anderson signing off. Take care. Bye-bye. God bless.